All right, hello everyone. Again, this is Bill Riley. We're going to go ahead and get started. Thank you for joining us today. Before I introduce our speaker, I'd like to cover a couple of housekeeping items. We've got a number of folks joining us here today, so we're going to keep the phone lines muted during our presentation. Please know we are going to pause at the end for questions, so as we go, if you have any questions, please just use the question box of the GoToWebinar control panel. Like I said, we'll address as many as we can towards the end. And as always, after our session today, all registrants will receive a copy of the material plus a recording of our session. So with that, I'd like to introduce Carrie Spunar, Director of Marketing at Medical Advantage Group. Carrie, please take it away.
Thank you, Bill. Our presentation today is going to cover 4 objectives. We're going to identify which care delivery requirements to implement first in your practice, determine which care delivery requirements may take a little bit more time to implement, and what types of support you might need. And then we're going to take a look at what types of things you should look for in an external support firm. And then we're going to also introduce you to Medical Advantage Group CPC Plus solutions. So first, let me get started with reviewing very quickly the CPC Plus program. It's a 5-year program, multi-payer program that began on January 1st. We're nearing the end of the first quarter of participation. There's about 5,000 primary care practices currently participating in 14 regions across the U.S., and the program will expand into 10 new states this fall. Some of the the benefits that accrue to your practice is, first of all, you're among the early adopters in transforming care under the CMS's new care delivery model. And some of the benefits, obviously, are increased Medicare reimbursement to provide better patient care. You also gain experience with evolving payment models, and you also qualify for participation in the Advanced Alternative Payment model under MACRA. So these benefits really do help position your practice to succeed in value-based healthcare contracts. So let's take a look at priority care delivery requirements. There are 13 care delivery requirements for Track 1 and 24 requirements for Track 2. There are also 17 requirements for the Track 1 CPC practices. That is a lot of requirements. The next few slides will offer some guidance on how to prioritize which care delivery requirements to start first, second, and so on. So let's take a look first at your responsibilities. This is a picture of the change driver model, which really illustrates the overall vision for the program. There are 5 key drivers. Number 1, comprehensive primary care functions. 2, use of enhanced accountable payment. 3, optimal use of health IT. 4, continuous improvement driven by data. And 5, aligned payment reform. Our focus today will be on the comprehensive primary care functions. There are 5 primary care delivery functions that represent corridors of work or work tracks. Each function consists of various care delivery requirements for you to complete. The expectation is that your practice will implement capabilities in these 5 comprehensive primary care functions, which are access and continuity, care management, comprehensiveness and coordination, patient and caregiver experience, and planned care and population health. And in addition to completing these capabilities, you're expected also to report your progress to CMS through quarterly reports. So for the first year, CMS expects you to implement all the care delivery requirements. In fact, they expect that many of you will already be on your way to implementing more advanced requirements by the end of the year. Since the idea of the CPC Plus is to progressively implement capabilities, be assured the bar will continue to rise in terms of new requirements to implement each year. CMS will release new requirements in fall 2017, and that is only 5 months away. So where there is work, there is payment, and many of you have already received your first quarterly payment from CMS, and soon you'll be submitting your first progress report. So there's lots of work to be done. The earlier you start, the more successful you will be in CPC Plus. So CMS has done a great job of delivering you with lots of documentation to chart your path to CPC Plus success. They have also provided a variety of learning opportunities for you to participate in weekly, monthly, quarterly. Managing all these various program components can be daunting. If you have not started to chart your path, the next few slides will help laser focus you on key priority steps. The longer you wait to begin, the more difficult it will be to attain success in CPC+. So the first thing is, the best place to really start is the roadmap, which is outlined in the CPC+ Phase 1 Implementation Guide. CMS did a good job of creating a framework for implementing the requirements, and the roadmap really does include all the requirements you are expected to complete in the first year. The guide defines required care delivery requirements and breaks down incremental steps for practices to achieve in the first quarter. It also highlights additional requirements for Track 2 practices. There's also a CMS change packet, which is an excellent source of guidance on how to implement key requirements. The change packet offers tactics that you can start implementing today. The change tactics are broad and flexible to accommodate the needs of each practice. In essence, they serve as interpretive guidelines for each requirement and can be adapted to fit the unique needs of your practice. So be creative and flexible in determining which solutions will work best for your practice. The following slides will briefly highlight each requirement in the roadmap that your practice should have started already to implement. So we've got access and continuity. It is important to note that as we look at the requirements, that not all requirements are created equal. Some of the requirements are going to take time to implement and are referred to as incremental steps in the CMS roadmap. It is in your best interest to not pass over the incremental steps, as they are going to take a little bit longer to integrate into your practice. When looking at access and continuity, the first things that you really need to start focusing on is patients need to be able to access a practitioner 24 hours a day, 365 days a year. So you may be already providing this access through an answering service or with a pager. It's also important that you write down your protocol in terms of this access in a communication or a feedback loop so that you can explain it to others, and to update periodically this protocol as you change your process. The other important thing under this particular requirement is the providers need to be able to have real-time access to the electronic health record. If you have a portal to your EHR that patients can review labs, you have really the hard part completed. If you don't have a portal, talk to your EHR vendor about the portal and making sure that it is inoperable with your EHR. Again, writing down your protocols so that you can explain to others and updating them periodically will be helpful. The third thing about focus area on access and continuity is to identify your active patient population. You may have already started a process of identifying active versus inactive patients in some way. If you have not, you need to get started. For Track 2 participants, identify at least one alternative office strategy. This means you look at ways to see patients other than your 9 to 5 typical office hours. You might have earlier or later office hours, you might have Saturday or Sunday office hours, and you might see patients in their homes or senior assisted living centers. You might even visit by phone. In either case, implementing an alternative office strategy will take time. So these are just a few of the considerations that you must get in place early to support future care delivery requirements down the road. So let's take a look at care management. We get an awful lot of questions about care management. So in terms of care management, it's important to note that care management includes many parts of your practice. It's not just about having a registered nurse care manager. For instance, when your receptionist guides a patient to a specific specialist or other place to seek care or diagnostic studies, that is care management. When your medical assistant or receptionist gathers information ahead of the visit to make that visit proceed more smoothly, that is care management. When your staff enters data like a BMI code or does a fall risk assessment or does a PHQ-9, etc., that is care management. There are lots of ways to do care management. Registered nurse care managers, pharmacists, social workers should be used for more complex work that requires their specific expertise. For instance, having the nurse create a plan with a very high-risk patient after risk stratification is done is probably a good use of that nurse's time. One way to think about this is if it can be driven by a simple protocol or a simple script, then many of your current care team members could do it. If it requires more advanced expertise, consult with a professional. So here's another care management requirement, and this is for track 2. The other thing that you need to consider in implementing care management requirements is that it takes time to find the right candidate if you do choose to hire licensed professionals. Not only does it take time to find the right candidate, to train them, but then also it's going to take time to integrate them into the practice and have them start meeting the CPC plus performance threshold. If you wait until June to start your care management requirements, you're going to have a hard time completing all the requirements before they are due, so start now. Another consideration that you need to start on now is that you will need ADTs, or admission, discharge, and transfer data to meet the transition of care requirements. If you don't use them now, start thinking about how you're going to get them. If you don't have reliable ADTs now, start thinking about how you're going to be able to improve the reliability of the care transition data. Comprehensiveness and coordination. Some critical steps in this particular requirement is identifying the hospitals and ER for the majority of your patients. Again, that's going to involve a lot of data. Integrating behavioral health. That could mean selecting a strategy or a model, doing some psychosocial assessments, which will require a little bit of research, identifying high-risk populations. The important thing here is that particular requirement that you're going to need to start analyzing the data to improve quality and decrease the cost of a high-risk population and subpopulation. So getting the right data and implementing the right coordination processes is really going to help support that goal. So let's go to patient and caregiver engagement. So again, here's the Q1 tasks that are on the CMS roadmap. And this is all for all practices as well as track 2. And some of the critical steps in this particular requirement is the self-management support, which is really, you should be assessing your practice readiness to implement, training staff, adjusting your workflow, and implementing 3 high-risk conditions. The Patient Family Advisory Council is another critical step under this requirement. Again, identifying a process, dates, recruiting, and implementing the meetings all takes time. Planned care and population health. Critical steps here, identifying utilization and clinical quality measures at the practice and the provider level, using registry and EMR and payer reports to identify gaps in care. And I think one thing to remember here is that you're on a journey of practice transformation, and it's going to take time. Focus on getting traction with the requirements outlined in the Q1 roadmap. In a few days, you should be positioned to start on the Q2 requirements. So we're near the end of the first quarter, and CMS expects that you're making progress on implementing all these care delivery requirements we just reviewed. So you should be asking yourself, in what areas, are there areas that you're lagging? If so, what are some of the barriers you are experiencing? Are those barriers getting resolved, or are they persisting? The answers to these questions may impact whether or not you choose to seek assistance from an external source, and we'll discuss that a little bit later in the presentation. So we're just going to take a poll question here. And the question that is going to be...
yeah, everyone, you should see this appear on your screen just shortly. Give us a second. We'll get it going. There it is. So, are you comfortable with the progress you've made on implementing Q1 care delivery requirements? Please just select yes or no. We'll do a quick tally, and we'll go from there. Okay. All right, Carrie, so as you can see, it looks like 70% of our audience says yes, they're comfortable with the progress against the Q1 requirement. Very good.
All right, fantastic. 70% is very good. So let's take a look in terms of evaluating the complexity of requirements here. So there is no one-size-fits-all approach to CPC+. Complexity is going to vary based on the experience and expertise of each practice. What is simple for one practice to implement may be extremely complicated for another practice. However, here's a general framework you can use to evaluate each care delivery requirement based on processes, the data that's in your practice, the technology in your practice, and people. And given that 70% of you have obviously have already your practice are on your way. There's also the question in terms of maintaining the processes, the data, the technology, and the people within the practice to get you through to the end of the year in terms of implementing and transforming the care in your practice. For each requirement, it's going to be important to compare what is needed in terms of processes, data, technology, and people to what you have in place now or you will have in the near future. Whenever there is a gap between what you have and what you need, you should assess the estimated timeline to fill the gap, any costs associated with filling the gap, types of resources that you might need. That could be staff or EHR vendor support. The more gaps you identify, the more complex the requirement may be to implement for your practice. So when is a good time to start engaging external support? So your practice is going to benefit from external support in a variety of areas, including but not limited to whether care management needs training or skills refresher. Do you want to leverage your team more and enhance staff roles? Do you want to have support in terms of new processes through workflow design and development? Do you want to increase efficiency of your practice using QI tools? Is your data actionable? Do you need help with documentation and data capture? Support can be both short-term to kickstart a project or long-term to meet ongoing needs. So when to consider external support? At some point, for many of you, you'll make a decision on what best is for your practice. Obviously, if you have unfulfilled gaps in requirements reporting, if there's a missed deadline, if you're struggling with resources, hiring a care manager or training staff, maybe you need guidance in forming a high-level strategy, or maybe just having some more specialized expertise for a limited amount of time with regard to complex data analytics, such as risk stratification models. Maybe you need some more detailed knowledge of technology or EHR system capabilities, or more training and education to build capacity within your team. You've got, the premise behind the CPC Plus is to use the upfront money that CMS pays you to reinvest in your practice to improve quality of care. If you do not use the money, you risk losing it. You have options. So we have another question here that we'd like to ask.
Okay, everyone. So this is around engaging external support. Have you engaged external support to help implement CPC Plus in your practice? Please select yes or no. Okay, we see people weighing in. Give us just another second. All right, so Carrie, we can see that roughly it's a 60-40 split, 60% no, 40% have engaged help.
Okay.
Interesting.
Very interesting. So as we continue here, for the 60% and for those that may be looking down the road and maximizing performance in the CPC Plus, here are some things that you can look for in an external partner. Whether the partner has in-practice and remote support options, experience with CMS programs, do they work in practices to transform? Are they comfortable with implementing patient-centered capabilities in a practice? Do they understand or do they have the capacity to aggregate data and build an EHR agnostic solution for population health? Do they have established EHR vendor relationships? Do they understand practices? Do they have a track record of making practices successful in value-based healthcare programs? Do they have a knowledge base of external data sources, including claims? And care management is a key requirement in the CPC Plus program. The external partner should have a level of knowledge, in-depth knowledge in regard to care management programs and working with care teams. So we know that you have many options for external support. We hope that you consider Medical Advantage Group's CPC Plus solution. Our solution, our advantage is we deliver local support right to you in the practice. We also have remote service options. We have some value-added services such as billing and coding training, CareSpective for risk reports. Also, we deploy an all-payer, all-patient approach to performance improvement, meaning that our support helps you improve quality of performance in all your other contracts and programs as well. So our goal is to really, through our services, build competency in your practice so you can sustain the practice transformation efforts for years to come. So this provides just a quick snapshot in terms of Medical Advantage Group's CPC Plus solution. We've got practice transformation coaching, contract compliance, care management coaching, our CareSpective data analytics and reporting portal, which provides the risk stratification report, e-clinical quality measures submissions, and EHR optimization. So we're taking a look at transforming the practice, care management, overall contract compliance, really the data analytics and reporting, making sure that you get your quality measures submitted and your EHR is fine-tuned to support all the care delivery transformation that occurs in your practice. So I'm going to just give you just a brief introduction to some of these areas. The practice transformation coaching really is monthly on-site visits. We've got a step-by-step roadmap that really helps guide the implementation of the care delivery requirements in your practice. It goes much more in-depth than the change tactics and the roadmap. The practice transformation coaching also includes managing or project managing the contract compliance, making sure that you're hitting all the deliverables and the reporting deliverables, as well as the billing and coding workshops to optimize your performance in the contract, and as well as the accessing the CareSpective data reports. Care management coaching. If the care management coaching service really does help provide practices with a step-by-step guidance for integrating a care manager into the practice and meeting the CPC Plus requirements. And Medical Advantage Group has a streamlined way of integrating and training new care managers that will save time and ultimately result in a bigger impact on the population. And the earlier that you select a care manager, train, and start impacting your population, the better your scores in the CPC Plus program. So the care management coaching really does, similar to the practice transformation coaching, provides monthly on-site visits from a care management mentor. The CareSpective data reporting and analysis services, Medical Advantage Group has a health data warehouse already designed that supports the intake of data from CMS and other commercial payers. So we have a convenient web-based reporting service that helps practices risk stratify the patients in order to efficiently allocate resources to the patients in greatest need and to achieve and maintain accurate performance in HCC-based payment programs by identifying coding gaps and opportunities. EHR optimization service, we have HIT experts that work right in your practice to optimize your EHR investment for data collection and reporting to CMS, and we also offer the training of your practice staff as well. The e-clinical quality measures service really is the same HIT expert is working in your practice to help manage the submission of the clinical quality measures to CMS. We get it right the first time, so it's important to have that expertise right there to walk you through. We also, the billing and coding training is offered for all of our services because really it's all about documentation and data capture, and And that is the way to maximize your performance, is working with the data. And then we also offer contract compliance assistance. So really, you know, we understand that practices have a lot of contracts that they need to manage. We have somebody that really, in terms of this service, that will come in and work with you one-on-one and manage all the contract compliance aspects of the CPC program for you, so that you don't have to dig into the detail. So for the past 20 years, we have helped physicians prepare for change, and we can help your practice too. And so here's a little bit of information about Medical Advantage Group. If you'd like more information, I invite you to visit our website, where we have more information about our services, or attend an upcoming webinar to hear best practices from our solution experts. So these are people, subject matter experts in the field, who will be discussing how to maximize clinical quality measures, data collection in CPC Plus, and best practices for diagnosis coding, and really maximizing HEDIS for enhanced quality and revenue. So I hope you can join us on April 6th, April 12th, and April 20th for the upcoming webinars. For more information about Medical Advantage Group or our CPC Plus services, please contact Sherry Kent if you're from Ohio, and here's our contact information, and Jeff McKay if you're from Michigan. So on that note, that is our presentation.
We actually did have a couple of questions. We got a couple minutes left here, Carrie, so if we can just take a second and talk about there have been a couple questions related to the role of the care manager, and I just wanted to go back to your point earlier about, depending on the nature of the patient, it does or does not need to be a formal official care manager resource.
No, it does not. Our program really trains. It's a team-based approach to care management. So our program really works with care team members to implement certain aspects of care management and coordination. So we can either train your care team members, or we can refresh skills for a licensed professional who will be in the practice to perform care management.
Very good. And then part two is our advice, you know, where to use the formal licensed care manager would be around the more difficult, high risk.
The more high risk
patients.
Right. So that is really just a division of labor, putting your more skilled resources where you need them most, and that is with the high-risk patients, and those will require more time to do. But as I mentioned in the presentation, there's a lot of different aspects that occur in a practice, a lot of different touch points in terms of care management. And so it's really about deploying a team-based care management model to really leverage all those existing members of your team to help support overall care management in the practice, and using the licensed professionals to do the hard work.
Okay, very good. Well, on behalf of Carrie and the rest of the team here, I'd like to thank you all for joining us here today. Like I mentioned at the beginning, we'll be following up shortly with the materials as well as the recording of today's session. Thanks again for joining us, and we hope to see you again soon on our next CPC Plus webinar. Thank you very much.